gentlemen, I hope Ramadan will bring to you happiness and prosperity. Today I'll talk you about pulmonary tuberculosis and its relation with the fast. Pulmonary tuberculosis means that the lungs will be diseased by tubercles, and these tubercles will coalesce with each other to form a large nodules, and these large nodules may coalesce again to form patchy areas of granulomas, which may be distract from the center and form a cavity, and these cavities may erode a blood vessel or a bronchus and causing many complications. The etiology of this disease caused by Mycobacterium tuberculosis bacteria. This bacteria is very resistant to the environment and also to the ordinary antibiotics used for the infectious diseases. This disease is transmitted from the patient by droplets through cough or sneeze. And this disease is easily transmitted and communicable to the contacts of the patient, so it is very dangerous to neglect its early diagnosis and its early management and treatments. The diagnosis of the disease depends on chest X-ray, must be done after 2 weeks if the patient suffering from any chest problem. The diagnosis will be confirmed by the bacteriological examination, by direct microscopic examination of his sputum. These changes which occurs in the pulmonary parenchyma, if neglected, will cause a complications which may deteriorate by time and causing death to the patient if neglected his treatment and the early diagnosis. So this criteria makes us to seek the advice of the chest physician as early as possible if there is any chest problem, especially in the slum areas and in the developing countries. The disease is more prevalent in the developing countries more than the well-developed countries. But in well-developed countries, disease returns back to them after the high prevalence of the AIDS in them. In the developing countries, the disease incidence increase with malnutrition, with poor standard of living, and the poor health education to the population, and also the bad special habits as smoking and addiction. Also, there are many diseases predisposed to the occurrence of pulmonary tuberculosis as compromising diseases as diabetes and the malignancies and the peptic ulcer, liver cirrhosis, renal failure. All these diseases may predispose to the occurrence of pulmonary tuberculosis. And also some drugs may predispose to pulmonary tuberculosis as the corticosteroid therapy and also the chemotherapy. These factors may predispose to the prevalence of tuberculosis. Pulmonary tuberculosis can be diagnosed early by the symptoms, which I'll say some short notes about it. Cough, the symptoms may be cough and also sputum. The sputum may be blood tinged, or there may be frank hemoptysis if the case is complicated. And also with these local symptoms, there may be a constitutional symptoms as rise of temperature, night sweating, loss of appetite, anorexia, loss of weight, and so on. Also, as the case is complicated, there will be a chest pain if the lesion near to the pleura, which covers the lung, and also the pleura may be affected by pleural effusion or pneumothorax or pneumothorax if the cavity of pulmonary tuberculosis open in the pleural sac. The complications, as I said, generally is very dangerous. Also, the cavities may erode in the blood vessel, and causing the bacilli will go with the bloodstream to other vital organs and to affect these vital organs by tuberculosis, and it is very dangerous. as meninges, as liver, as kidney, and so on. Also, all the testes and the ovaries, and so on. The bacteria may go to the lymphatic system through eroding the lymphatic vessels. Tuberculosis heals by fibrosis. This means that tuberculosis will, after recovery, the area affected by pulmonary tuberculosis will leave a fibrous tissue in the site of the affection. So if the disease is widely spread in pop lungs, so the pop lungs will be affected by a huge amount of fibrosis, which disables the patient and also causing a permanent disability to him. From all the previous, we can conclude that early diagnosis, early treatment with the regular treatment which prescribed by the chest physician, many regimens prescribed by the chest physician according to the economic state of the patient and also the country which treat this disease. All these regimens takes a time from 4 to more months, to 10 to 9 months of treatment. And also the drugs must be more than 2 drugs. But besides the treatment by drugs, the patient must take good nutrition, good rest, good housing condition, and also to control the case and to prevent the spread of the infection to the contacts. I must ventilate his place very well, and also to prevent the use of the special towels of the patient by other contacts. So if the patient takes these drugs, and I make all these procedures to control the case, the disease will be recovered very well, and no percentage of complications, and also no percentage of prevalence of the disease to other contacts, and so on, so can control the disease inside the patient and also inside the house and inside the community, and prevent its spread by the early diagnosis, I said, and also early treatment and making the measurements as I said. The treatment of tuberculosis is available, and there is a revolution in the drugs used for tuberculosis, which makes the recovery percentage near 100% if diagnosed early and if treatment starts early. The disease, if there is any activity, and also if the patient on the drug and the drug therapy, so the patient must take regular treatment and also take regular meals, so he can fast. But if the case is stationary, the patient can fast without any problem. Thank you very much.